to our Wednesday Medicare Lunch and Learns. And today we're going to talk briefly about Medicare broker commissions. And so hopefully that will be helpful to everyone. My name is Eileen Doherty, and I'm the director of the Colorado Gerontological Society. A Medicare broker is an agent, also known as a broker. They're licensed by the state in which they do business. So in order for a broker to be able to work in the state of Colorado, they have to pass the license requirements set out by the Colorado Division of Insurance. And even though they may be selling federal products, if you will, because Medicare Advantage plans, Medicare prescription drug plans, and Medicare supplements are, for the most part, come under federal regulation. The licensure has to come out of the state. Brokers, basically, they are paid by the insurance company. The insurance providers, basically, they contract with these agents or their agencies, and sometimes you'll get agents. You'll have an agency that employs 300-400 agents, and their job is to go out and identify and enroll Medicare beneficiaries, and however many Medicare beneficiaries that they're able to enroll in a Medicare Advantage plan, a Medicare prescription drug plan, or a Medicare supplement determines their commissions and what they are paid. The majority of agents will write most of their business from October the 15th through December the 7th. They will write some business to low-income older adults who have what's called the ability to enroll in some of the special needs plans because they're a Medicare, Medicaid beneficiary. But the majority of commissions and work is done during open enrollment. The pros and cons of working with a broker. The agent usually represents a large number of insurers. We have two types of agents. We have an exclusive agent, which means that they only sell for one company, or we have the broker agents who sell multiple lines of business for multiple companies. So, for example, a Kaiser agent or broker only sells Kaiser. State Farm only sells State Farm products. They won't sell other products. Whereas an agent that is signed up with an independent practice agency will sell for multiple companies. The advantage of an agent that is a broker that sells for multiple companies is that they can do side-by-side comparisons. And a lot of times that's very helpful to customers or Medicare beneficiaries, again, because they want to be able to see, if I buy this plan A, or if I buy plan B, what does that look like and how do they compare? Agents can do comparisons with other businesses that are companies that they don't contract with, but they're not going to get paid for that. Now, there's been a lot of concern over the years by Medicare about broker activities. There's been a lot of concern about people getting sold plans that they are not interested in. They didn't know what they signed up with. They weren't necessarily given all the information. And so Medicare has taken a pretty active role at this point in time in terms of reviewing and making sure that they are looking at what are the marketing strategies and tactics that are used by agents and looking for non-compliance or fraud and abuse. So some of you may have experienced that started last year, I believe, where if you are actually buying a Medicare Advantage plan or a prescription drug plan, one of the things that happens is that as you are in the process of either doing that by phone or in person, the agent is required to record that call. And they have to get your permission to record it. And they have to tell you when they're going to stop and start the call, because those calls then are monitored by Medicare or CMS for the purpose of making sure that you are fully understanding what it is that you are purchasing. Another strategy that is frequently used, especially with educational programs, is something called secret shoppers. And these are individuals who are paid for by Medicare to specifically attend educational or sales events, and brokers can offer sales events, which means that they're there for the specific purpose of selling you a product, or they can offer educational events, and they are there specifically only for learning and information. But there are specific guidelines, again, by Medicare about what can and cannot be said and done. And if a broker violates any of those requirements, if they do what's called sometimes steering, meaning that they're directing your decision making toward one product or the other, then the secret shoppers report that, and then the broker can in fact be sanctioned or can be required to go back to more training or whatever Medicare might decide is necessary. I have over the years seen where there are brokers that work for a specific company, and because they are all violating the Medicare guidelines, I've seen where the entire company has been sanctioned or not allowed to provide any sales to people. So what do Medicare agent commissions mean for a Medicare beneficiary? This is really kind of the crux of the question this morning. Medicare agents are a really important resource for Medicare beneficiaries. And the real benefit of that is that they have a lot of training about by the very specific companies that they are representing. There's lots of training that goes on, lots of ongoing management and supervision, lots of review of policies. And so they're really, the companies that sell these products work very hard to make sure that their agents actually understand what they're selling and how that is beneficial to clients or beneficiaries. But because of the way that they are paid, which is via commission, sometimes the incentives for how an individual gets paid might be in conflict with what is in the client or the beneficiary's best interest. Another thing that happens is that Medicare beneficiaries sometimes can benefit if they switch or work or change their renewals or whatever. But again, agents may not be motivated to help or to review those again because the commission may be very low. So that's one of the reasons that it's absolutely essential for Medicare beneficiaries to take their own initiative and to compare their plans annually. That can be done independently, which is what most people do. And they review, what they currently have. They look at what changes might make sense and then make changes accordingly. You can also attend educational programs, whether those are in person or whether those are on virtual meetings. You could also seek the counsel and support of non-commissioned or non-licensed brokers or agents. So you could go to an agency like the Senior Health Insurance Counseling Program. They're going to simply give you the basic facts, and then you leave there and you decide, either with the help of an agent or independently, what you want to enroll in. Or you can come to an organization like the Gerontological Society, and we can provide similar services, although we can go the next step of helping you to enroll for certain kinds of things. Medicare Advantage and Part D are then regulated by Medicare. And because they're very closely regulated by Medicare, Medicare also basically sets the commissions on what an individual can be paid for or paid if they sell a specific policy. And those commissions are changed on an annual basis. So in 2025, a Medicare Advantage broker, if they sell you a new Part C plan, and there are a number of those companies in Colorado this year selling plans, if you sign up for the first time, they get a $626 per member per year commission. If you stay with that company or you renewed, you signed up last year or 10 years ago, they get a renewal commission of $313 per member per year. So again, that is what is paid by Medicare to the Medicare Advantage plans. And then that is what is passed on in the form of broker commissions. There's a lot of restrictions around bonuses and other incentives, if you will, that Medicare does not approve. If you're buying a Part D plan or a prescription drug plan, not all of the Part D plans in Colorado this year are paying commissions. My read on that is that that is one of the ways that the Part D companies are saving money as a result of the $2,000 out-of-pocket cap. So if you buy a Part D plan on an initial commission and you use a broker, it's $109 per member per year. If you go or stay with the same company, it is $55 per member per year. So if you had a Cigna policy in 2024 and you decide to keep that Cigna policy in 2025, then the person would get $55. Whether you talk to that broker or not doesn't really matter. They're still going to get that commission if you stay with them. Medicare supplements work a little bit differently. So they are more regulated, if you will, by the state or the Colorado Department of Insurance. So the average commission is usually around 20 to 22% of the first year's premium. So the Medicare Advantage plans, most of them, or they're really focused on selling, is their plans with a zero premium. In the Medicare supplement world, you're looking at somewhere usually around $125 to $200, $250 annual premium, and so they get a portion of that. And then if you stay with your Medicare supplement, there is a renewal commission. And usually that's lower, but often it's around 10%. These commissions vary by state and by plan, so they're not as regulated, if you will, as the other ones. So if we look at a Medicare supplement, where the premiums in September of 2024, which is the last published date we have for the premiums at age 65 for a Medicare supplement in Colorado, range from about $125 to about $300 a month for a Plan G. So assuming that you would buy the $125 option for 12 months, it's approximately $1,500 a year. If you get the 22% commission, you get $330. If you get a renewal commission, stay with your Plan G, the agent gets about $150. So you can see, based on these differences in commissions, as to why a broker might be inclined to encourage and or sell you a Medicare Part D or Part C or a Medicare Advantage plan, because their commissions are going to be almost twice what they are, both on the initial commission as well as on the renewal. So there's always been a lot of concern about why brokers tend to favor, if you will, the enrollment in Medicare Advantage. And while Medicare Advantage has lots of benefits that a Medicare supplement doesn't, a Medicare supplement usually, especially as people use higher or more Medicare services and more procedures, you have to really weigh whether or not there is the cost benefit for you enrolling in one over the other. Knowing that if you have a Medicare supplement, you enroll in a Medicare Advantage. If you have any pre-existing conditions, you probably will not be able to renew or sign up again for your Medicare supplement. So kind of the buyer beware in this presentation is that while a broker really, should be guiding you to what to purchase, the policy at this point in time by Medicare and the state of Colorado may not necessarily have your best interests at heart based on how the commission structure is set up. We also want to warn people that brokers may sometimes face a potential conflict of interest because they get compensated based on the number of beneficiaries that they sign up for either a Medicare Advantage plan or a Medicare supplement or a Medicare Part D. And they may aggressively work one line of business over the other simply because they get reimbursed more. So it's important to think about what is your relationship with your broker. The very first thing that you want to look at is you want to make sure that they are licensed. They are licensed by the state of Colorado by taking an exam, paying their license fee, and being allowed then to practice. Colorado, as many other states, can have insurance brokers licensed or living in other states who are licensed to sell in Colorado. So that's a pretty typical relationship for people who are in the Medicare supplement world. If you are in the Medicare Advantage or Part D world, you have to be licensed in the state that you are selling. A second really important characteristic of your relationship with your broker is, do you trust them? Do you believe that they have your best interest at heart and that they understand the different advantages and disadvantages, the strengths and weaknesses of the plans that they are selling you? Do you trust them that they will give you accurate information that you can work with? Another thing that's really important is integrity. Are they, um, you know, are they a moral, upstanding individual who, again, has you in mind and works with the highest code of ethics and the highest morals? Do they listen to you? Do they really try to understand what it is that you need and put their needs ahead of yours and ahead or of theirs and ahead of their commissions? And another thing that brokers, I think, need to really pay attention to is, do they work with you if you have a question or an issue and you really don't get a commission? Some people are so focused on that commission and that one-time sale and then the renewal fee, and that comes to them automatically, whether they do anything or not. And so that can be, again, very beneficial to you, or it can be something that's not as beneficial as you might like. And that concludes our statements for today related to brokers. Just a quick overview of a couple of society programs. So we do have a dental program that can provide services for people in the Metro Denver area, as well as west of I-25, excluding Colorado Springs and Pueblo. We have a telephone buddy program that's available with volunteers calling on a regular basis, as well as many different counseling programs and information services. We also have our Salute to Seniors, which is scheduled next year for July or August the 23rd in person and August the 24th virtually. This is part of our Medicare Monday series, and then we have quite a bit of information at both our website, our YouTube channel, and our newsletter. And lastly, we do a lot of work in advocacy and public policy, trying to make sure that the needs of older adults are best represented at primarily the state level, but we do some work at the local and federal level. And that brings our comments to a close today. So thank you for joining us.